in your explanation, what is health optimization?
Cliff's Notes of health optimization, I think, is really taking someone, man or woman, and just having them feel like, man, all gears are clicking. I'm really able to fully engage with my family, my work. I feel like I have good connections. I'm able to accomplish all the things that all my goals are. That's what really health optimization is to me, is getting people to that point.
Would you say that it's the same thing as longevity, or would you classify that as something different?
I think they have a lot of commingling factors, right? But I think that longevity is a little bit more ethereal, because I don't think any of us really understand completely what does that really mean. Does that mean our telomeres are not shortening as much? We have less DNA damage? Does it mean we have less different forms of chronic disease? I don't think anyone knows the answer. Is there like a hard stop to that 120 years mark that we just won't be able to bust through? There's so much that is left to be determined there that I like to stick more to the health optimization discussions, because I'm a little more grounded.
Yeah, that makes sense. That makes sense. Now, we have a lot of patients that come in and say longevity is one of their goals. Do you probe them on that further? Do you kind of know what they mean by that? What do you think about that when they list that as sometimes it's their only goal? It's just longevity.
Yeah. Usually there's more to it than that, right? Usually they're struggling with something in their life. They feel like something is not the way it should be, whether that's their energy levels or their sleep, or just unpacking that a little bit. But just that generalized term of longevity, to me, it doesn't mean, we need to start you on some drug X that thinks is going to improve your longevity, because the science just isn't there right now. It's way too early for that type of intervention.
That makes sense. One of the things that I think about when people come in with saying that they want to prioritize longevity, first thing that comes to mind is heart health for me, because that's our number one killer.
Right.
And sometimes they'll say that specifically, that they want to prioritize heart health. When you hear that from patients, what strategies become most important to you?
Yeah, I think that is more in line with being like the proactive, preventative care side of things, which is, I think, where we can find a very good stride when it comes to a lot of the things that you mentioned: heart disease prevention. What is your family history? What is your personal history? And there's a lot of interventions that make sense there, versus just kind of this blanket longevity term. I don't really know a whole lot how to help people there.
Yeah. So inside of health optimization, what are the most common concerns you'll actually hear from patients in regards to their health?
A lot of common concerns are people that have a strong family history of certain conditions. So my dad died of cancer, lung cancer. Maybe he was a smoker, but I'm still worried about, have some inherent risk there. Family member died of heart disease. A lot of those fears bubble up to the surface about, okay, I think that I probably have a genetic predisposition here. What can we do to not go down that same pathway? Is probably one of the more common things. I think people also bring up a lot of times when maybe they're older fathers and mothers, and they're worried about being able to keep up with their kids, and that's important to them. They want to feel strong enough to support their children, and even also as people get older, their grandchildren, the same types of discussions come up.
Yeah, that's a really interesting point too, because I'll hear that frequently about they have kids, or now they have grandkids, and they want to be active in that space for as long as possible. What strategies become really important? So I'm thinking about musculoskeletal health. I'm thinking about functional mobility. We'll give some guidance on kind of their blood work and their risk factors, but what other things are you maybe trying to get them to think about or look into?
Yeah, I think lean body mass is, as you mentioned, very critical, right? We know that there's so many important health outcomes that stem from having a good body composition that weighs in favor of muscle. And I think there's so much that's tied to your psychological well-being in terms of how much you can do, how much you can function and perform, right? It's very hard to be somebody that is inactive, sedentary, that also has a very good overall sense of their quality of life and well-being. So I think all those things are tied together. And so helping people be able to do those types of things, put on muscle when you're older, above 60 or even beyond that, right? Be able to have motivation to perform exercise, and, I think that's where a lot of benefit comes from.
Yeah, that makes sense. We do a lot of blood work, which is super helpful in making recommendations to patients. But what do you think, in order for people to really understand their foundation that they're starting from when it comes to optimizing their health. What other tests do you think are underutilized or under-recommended in the space?
Yeah, I think there's a lot of underutilized in that space for sure. I think blood work is a good place to start. I think body composition scanning is becoming more widely available. It used to be that these were inaccessible, very expensive tests. Now they're not. I mean, a lot of gyms have bioimpedance resistance that can give you a rough sense of your overall body fat and muscle composition. So I think that's still underutilized, though, I would say.
Yeah.
I think that when it comes to heart disease, there's scans that can detect very low amounts of plaque, very early stage disease. We've kind of come way beyond the calcium scores from the 90s and now have tools that are much more sensitive and specific.
Yeah.
So you can start
like a CT angiogram?
Correct, yeah, with artificial intelligence algorithms that really make it even so you don't have to be a cardiologist to interpret these scans. You can look at them and say, oh, it looks like there's X amount of plaque and stenosis, and here's the treatment plan we're going to do to lower your risk. So that's with heart disease. And then with cancer, there's a really burgeoning tool set of looking at diagnosing earlier stage cancers through blood testing, right? So looking at circulating tumor-free DNA of certain cancers that usually don't show up until they're very advanced, such as the gastrointestinal malignancies, pancreatic cancer, gallbladder cancer, liver cancer, et cetera, that now you can have a way of saying, okay, this blood test will do a pretty good job, 95+% negative predictive value. So if it's negative, you can rest pretty well assured that you've taken that risk factor off the table for now. So, so that covers a couple of the really good ones out there.
I would maybe add sleep apnea testing to that. I feel like I recommend that frequently, especially when considering hormones and their connection with sleep. That's always high on my list.
Yeah, people think that you have to be a 300-pounder that snores a lot to have sleep apnea, and obviously it's much more prevalent than that. If you look at the very high incidence, like in Asians, for instance, Asians have a very high incidence of sleep apnea, and they're not obese. It's not from that. It's just that their anatomy of the upper airway leads to obstructing more often. So I agree. It's a simple test. The home sleep studies now have gotten very good. You don't have to do this fancy in-lab polysomnography where you're hooked up to 100 different wires and you're sleeping in a weird place. You can do them from home now. So yeah, I agree.
If you benefited from this conversation and want to learn more, feel free to check us out at marekhealth.com, where you can connect with our team and we can go more in depth with you.